Welcome, beauties and gorgeous gals. Welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Sonia Johnson. Thank you for joining me. Today we're in Indianapolis, of course, and it's sunny out today. It's been raining, but nothing major. So, if you'd like to share the screen, press the share button at the end, in the bottom of your screen, and sharing is caring. If you think a friend can use this message today, tag them. Welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and national speaker. I help women who have problems with their skin with the use of my products and lectures. After using my products and listening to my lectures, they will develop even and clear skin tone with increased confidence. If you think that's you, follow me on facebook.com/Dr. Sonia Johnson, DrSonyaJohnson. Well, today is part 3 of how the psyche affects your skin. And particularly, we're going to talk about the interventions that, proven interventions that can be used with traditional dermatological care to help you with your skin disorders. As you recall, 2 weeks ago, we talked about the 3 common psychodermatological skin disorders. Number 1 was when your depression or skin or your psyche problems causes your skin disorders to get out of control. And we see that with eczema as well as with acne. Number 2 is when your skin disorders causes psychological problems, in which we see that with hair loss, alopecia areata, or even with psoriasis. And lastly is when your psychological or psychiatric problems manifest itself as skin disorders, and we see that with delusional parasitosis. And in that case, that's when we're talking about you seeing things that are not there. You're feeling bugs crawling in your skin, and that's nothing there at all. Last week, we talked about why people get so distressed with skin problems. The number one reason was the skin is the biggest organ. So you can see when they have a problem, such as, again, psoriasis. And unlike a person with diabetes or high blood pressure, you don't know they have problems. Number 2, a person, one condition can affect one person differently, whereas another person doesn't affect them at all. So it really depends on how the person accepts or deals with their condition. That can cause a severe stress. And lastly, what also can cause severe stress is the fact that they don't know when they're going to have a flare. So they can be going around, and next thing you know, they have skin disorders, a skin problem that shows up, and they had no idea it was going to happen. We see that a lot with psoriasis or even with eczema. They're itching and scratching, and people can see what they're dealing with, but they have no control over that. So they don't know when to expect it. So all 3 of those can lead to a person feeling loss of control, and that's really what causes the stressor, is the lack of control of this disorder. So today, like I said, we're going to talk about what are common proven interventions that can be used with traditional dermatological services to help a person with their skin disorders. And number 1, of course, is seeing a dermatologist. This is when you want to go to see a board-certified dermatologist. And I say that because we are trained to know exactly what the problem is, and we can save you time. Save your time and get right to the bottom of what's the cause, and prescribe or treat you with products we have in the office that we sell, or prescriptions. And not to say that your primary care doctor cannot do the same, but if you've seen them and they haven't alleviated the symptom or helped you with your problem, then by all means see a dermatologist. So besides traditional dermatological services, there's also other things such as hypnosis that has been proven to help a person calm down and deal with the condition. Imagery, guided imagery, in which you see yourself, your skin in the way you want it to be. So you visualize yourself with this clear skin or not having a problem, or at least controlling it better. Also, we see this with behavior modification or muscle relaxation or meditation. That's another one also that's really good. So again, these are other factors and treatments we can employ to help a person control their skin problems. While the doctor, the prescriptions they've prescribed or the services they're rendering is working, the goal again is to control the mind, control your reaction to this flare that a person is having. So, and again, one thing we need to consider also is when people have manifestations of picking at their skin or have manifestations of skin problems, we need to make sure there's no internal involvement. Meaning, if you see a person picking at their skin, then is that obsessive compulsive disorder, or is that undiagnosed attention deficit disorder? And so we just need to make sure we don't overlook those things also. Any questions? Well, thank you again for watching the Gorgeous Glow Skin Show. Next week, we'll be talking about everyday practices we can do to help unmask your beautiful skin. I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and national speaker. I help women who have problems with their skin with my products and lectures. After listening to my lectures and using my products, they will develop even a clear skin tone with increased confidence. Follow me on Facebook.com/Dr. Sonia Johnson, DrSonyaJohnson. Thank you.